We have heard concerns of Canadians and experts about whether the healthcare system will be ready to accommodate MAiD requests for persons whose sole medical condition is a mental illness by March 17th, 2023. This is a very complex question. Many are concerned about how this will impact them and their loved ones. We also know that some provinces, territories, and those working in the healthcare system say that more time is needed. That includes having the time to implement those practice standards and to complete and disseminate key resources that are being developed for clinicians and other healthcare system partners to address these more complex MAiD requests. Together, I believe those two reports will provide strong guidance on complex questions relating to MAiD in Canada, beyond eligibility for persons with a mental illness. We are not making this decision in a vacuum. We are listening to what we are hearing and being responsive to make sure we move forward in a prudent way. We know we need to get this right in order to protect those who are vulnerable and also to support an individual's autonomy and freedom of choice. For these reasons, today we are letting Canadians know that our government intends to work with our parliamentary colleagues in the House and Senate to negotiate an extension of the March 17th, 2023 eligibility date. This will require legislation. This work will begin in the new year. Right now, we want all Canadians to know, especially those exempted by the current exemption of eligibility from MAiD, that we plan to take this next step. This is a top priority for our government, and we want to reassure Canadians that we are committed to ensuring that our laws protect everyone while supporting the autonomy and freedom of choice that are central to Canada's MAiD regime. Merci. Thank you. I'm now happy to take your questions, beginning with questions pertaining to MAiD.
And we'll take questions in the room first. If you're online and you want to ask a question, please use the raise hand function to notify us of a question if we have time.
Hey there, David Baxter with Global News. Just as you're working forward, what protections and safeguards are you going to have in place for people suffering mental illness who may be looking for MAiD? Because, of course, suicidal ideation may just also be a symptom of someone experiencing mental illness.
That's a good question. I think it's clear that if you're thinking about suicide, that this is not a reason to get medical assistance in dying. It's clear in the expert report that that's not what this is about. That we're talking about mental disorders that are evaluated over a much longer period of time with a greater degree of expertise. I want to reassure Canadians that if you're thinking about suicide, you should get help. But the MAiD regime is not there for that. That's something else. I don't know if, Carolyn, you want to add to that?
Yes, I think the expert panel made it clear that the safeguards in place now are pretty well the same safeguards that would be needed for mental illness because it is not suicide. But what they are recommending is that in the assessor process, that a psychiatrist would be part of any assessment team to make sure that this is indeed because of mental illness and not suicidal ideation.
And just on trying to get the new legislation passed, of course, the House has now risen. It's not coming back until January 30th. That leaves just over a month's time to actually pass this new legislation, negotiate with the other parties. What is this work going to look like over the next few weeks? Because it's a very, very short time until you hit that March deadline.
Yeah, thank you for that question. It's a good question. We have only to negotiate an extension. So the only part of the legislation will be an extension to the coming into effect, or the coming into effect of the regime, or the devolution of the sunset clause. So that's all we're doing here. The regime will come into place at the end of that time period. So we're just seeking to move that time period back. We have begun to have discussions informally. I'm not going to negotiate in the public sphere right now, but we do think that there's widespread support amongst parliamentarians in both houses to move prudently. We've heard Canadians, we've heard our parliamentary colleagues and others, and we think that we can get this done.
Hi, Minister Rafi Boudjikanian, CBC News. To when would this be delayed to? Is it indefinite? What kind of time frame are you looking at here?
Again, I'm not going to commit to a particular period of time. I want to speak with my parliamentary colleagues first. There are a number of people in Canada, including the chair of the expert committee, Dr. Mona Gupta, working with her colleagues across Canada, who feel that clinicians are ready, to move forward now with the March 23rd deadline. There are others who've expressed concerns and would like a short delay. So I'm not going to commit to a particular period of time. We do have to respect decisions of the courts. They have said that medical assistance in dying is a right that Canadians have, and so the process will continue to move forward, but we're going to do it in a measured and prudent way, as we have done from the beginning, and we will see what the fruit of those negotiations will be.
And is there a chance that medical aid in dying for mental health reasons won't happen?
I think that would that would require a very different piece of legislation. Right now, what we're doing is delaying the coming into force after a sunset clause. That would require a very different piece of legislation, and I think that would run us afoul of the courts.
Hi, Catherine Levesque, National Post. Just in terms of the timeline, so just to be clear, so I understand there's going to be a bill to amend the legislation. Are you intending on waiting till the special joint committee tabled its final report to do that, or might it happen when the House comes back?
Well, as I mentioned in the prepared text, this will actually give the special joint committee more time to. They still have their deadline, but it will give us more time to incorporate anything that they might have said about mental illness as a sole criterion for people seeking MAiD. All this will do is push back the coming into force of the possibility of seeking MAiD with mental illness as a sole criterion. It won't affect the timelines of the committee, but will give us additional time to see what the committee has said and see if there's any additional guidance that they want to add in the course of their deliberations.
So just to be crystal clear, you could table legislation as soon as the House comes back.
That's correct. Yeah. Remember, all this legislation is doing is delaying the coming into effect of the sunset clause.
And I just had a question for Minister Bennett. I was just wondering if you shared any of the concerns from the opposition in terms of the safeguards right now for people who would be seeking MAiD who have a mental disorder.
I think that the expert panel was very clear that the safeguards that are in place now in the legislation are excellent. What is now being drafted by the expert panel in a small group is practice guidelines, and with the practice guidelines will come the need for training, education, and being able to make sure people understand what those guidelines are. In terms of the questions, in terms of how you train somebody to do that assessment for something that is solely for a medical illness. I think that there is very clear, I think, consensus. This would be very rare. That the assessment may be pending over a long period of time, a number of different assessments, and so I think that I have been reassured by Dr. Gupta and many others that the safeguards are in place and they are very strong.
Stephanie Levitz, the Toronto Star. The New Democrats have already said that they would support probably some kind of extension, and it would be in exchange for the government implementing greater supports and greater access to services, because, you know, we understand that the wait times, for example, to seek psychiatric or psychological care can be quite long, and there's concern that people seek to avail themselves of MAiD in the interim while they're waiting to see help. So I guess I wonder if, as part of the healthcare funding talks, there are talks in turn then to increase the cash flow to provinces tied specifically to providing supports around medical assistance in dying.
The probably a question best addressed either to Minister Bennett or Mr. Duclos, and I'll turn the mic over to Minister Bennett in a second. But what I would say is we have, as a government, invested massively already in mental health and in supporting the provinces and territories in that regard. It falls under healthcare falls under provincial jurisdiction. And I would also take this moment to repeat, given the way you framed your question, that the safeguards that are put in place for whatever reason one seeks MAiD doesn't mean that it's just a choice that one can make lightly. There have to be medical evaluations. You have to fit within the criteria. Yes, it's a personal choice that one makes in collaboration with one's doctor, and it's a very personal choice and a very difficult choice. But it isn't just the case that you can, I want to assure Canadians that it isn't just the case that you can walk off the street and seek MAiD if you're feeling depressed or and you should be seeking help. Absolutely. But it isn't the case, as Minister Bennett has pointed out, as the expert committee has said in its report, that this will be anything but a rare or infrequent practice after a long period of treatment. And so I just want to reassure you, and I want to reassure Canadians, but I'm happy to turn over the rest of the question to Minister Bennett.
As you know, the $5 billion that was in the 2017 bilateral agreements with all the provinces and territories continues in terms of about $600 million a year, really up to 2027. But in budget 2021, there was over $13 million dedicated for provinces to make sure that they could adequately implement MAiD. And so I think that, again, these conversations are ongoing. We know we have work to do on social determinants of health, on poverty and housing. We know we've got work to do on palliative care. And I think the Pain Task Force has done a very good job in explaining what we need to be doing sort of better in terms of practitioners understanding pain. But I think that this is something that we will work with the provinces and territories to make sure this is done properly.
This is my follow-up to Minister Lametti. I think, what changed for you? It seems as though you'd been pretty resolute up until 4 o'clock this afternoon that this March deadline was going ahead. So I'm wondering, was there a tipping point, a story you heard, something that made you think, no, we're going to go ahead and try and get this extension?
Well, I think I've been listening. Certainly, if you saw my committee appearance last week, I was open to listening to my colleagues who were asking the various questions in that context. I have been watching. We have been, obviously, we've come through a period where there's been a pandemic, and certainly that has created challenges in the healthcare system. We've been watching, and Minister Duclos has been working very carefully with provincial and territorial counterparts on the implementation of this. We've had the expert report, and I think it is about making sure that everybody's ready. So some clinicians, for example, in Dr. Gupta's view, are ready. They have dealt with these kinds of illnesses for years. It's their area of expertise, and this would be another tool in their toolkit. But not everybody's ready. We need in order for this to work and for Canadians to be on the same page at the same time, we need the didactic materials to be ready. We need people's, I suppose, attitudes to be aligned about their readiness. And so I think at the end of the day, we want to be prudent. We want to move in a step-by-step way so that we don't make mistakes. And so at the end of the day, it was an evolution.